Lots of people ask me, why are my orthotics better than some of the things that they purchase in the pharmacy or even online? Well, I explain to them that the orthotics that they think they're getting are basically arch supports, the little fluffy little things that they put inside their shoes. And yes, some people can actually benefit from them if they just need a little bit of cushioning or a little bit of support. But most people that have problems that don't respond to this, it's simply because they're not designed to help their particular problem. You have a particular need. Those inserts are not designed for your particular needs. They're designed to help the shoe store sell more inserts. There's millions of them. All sorts of companies are coming out with all sorts of arch supports. Most of them don't work. And that's because they're made for the average person. You're not the average person. I've never seen an average person. I'm not an average person. And the orthotics that I'm wearing are made specially for my particular problem. I actually have a heel spur. And my orthotics are working really, really nicely. And it enables me to walk miles. And I'm 55 years old and I'm not skinny. So what's the difference? Well, let's take a look at some of the over-the-counter orthotics. And as you can see over here, it has this nice, pretty orange color. And it's actually something very flimsy. It's not really holding your foot. If I could squeeze this with my two fingers, what do you think is happening when you're putting 150 pounds of pressure on it? It doesn't work. It doesn't help you. It has some wonderful cushioning, which is really nice, but that's as far as it goes. When you have a real orthotic, something that's made for your foot, yes, it could be soft and comfortable and flexible, but if you look at this, it has a special shape. This particular one is made for women that need to have a slim orthotic that's shaped to their foot, that supports the structure in their foot. This is not something that would fit everybody. It's specially designed for this particular woman. It fits into most of the shoes that they're wearing, so they can walk very comfortably without having any heel pain, arch pain, and perhaps even metatarsal pain, or sometimes even ankle pain. However, there are circumstances where people don't need this, and they need to have something a little bit more solid. So for example, in a woman that's doing a lot of exercise, running and aerobics, yes, she needs to have something that's soft and comfortable with a lot of support. And looking at this particular model, it's a little bit stiffer. It still has some flexibility to work with the foot, but there's a lot of support in the heel, there's a lot of support in the arch, because it's shaped exactly to this person's needs. This cannot be gotten in an off-the-counter type of device. In men such as myself that need to have something a little bit more supportive and again a little bit more comfort, I use this type of orthotic in my running shoes. So we have the comfort, we have the cushioning, yet we have the support. Again, it's made for my particular foot needs. We have people who weigh 400 or 500 pounds. They need a different type of orthotic. So different orthotics do different things. This cannot be replicated by something that's over the counter. You need to be examined properly, you need to be evaluated, and in many instances, using our computerized gait analysis or perhaps even our digital technology to fabricate an orthotic, get you a wonderful fit, a great device that will give you years of comfort.